I can imagine you probably look a bit like this. So you'll literally be looking shocked. Oh, what is this? Or if the examiner suddenly make you take a collateral history of a boy with a learning disability, for example, which is what happened in the last year. So believe it or not, these uncertainties and unfamiliar situations happen all the time. So it's not only happened within med school, within exams, but also happens in clinical life as well. And as you probably think, it will cause a lot of stress. You guys might be thinking, oh, am I going to fail my ISCE? Is this going to jeopardize my career, my F1 placements? What am I going to do? I can't answer any of the questions. I don't know any of the differential diagnosis, and it must have been very stressful. But the truth is, if we talk about statistics-wise, you may or may not believe, and probably be surprised if you do have one of these stations, that quite a lot of people do end up passing this station. And probably because everyone is in a similar situation. Everyone is not familiar about this kind of stuff. Everyone will forget to say important things, safeguarding in children, check for drugs and everything. And most people will end up passing the station. So I found out this funny Mr. Bean video released a few years back about him who basically sat an exam, and he actually sat the wrong exam. He was meant to be sitting an trigonometry paper, but he started doing an algebra paper. And this might look a little bit similar if we are basically given a scenario that you've never seen before, that you've never rehearsed before. It's not your typical chest pain, it's not your typical abdominal pain, it's not your PV bleeding for your obs and gynae, for example. And it is natural for us to do quite a lot of different things. You might pretend there's a nightmare coming, but sooner than later, you will eventually have to acknowledge that, oh, this is my real ISCE, and move on. And tips number 2 is actually one of the good things that we can take from this, is to pretend to know what you're doing. As long as you're natural, as long as you're confident, you will score a few marks, even though you may or may not get to the right thing straight away. Point 3 is also a good one. Try to understand the solution, what kind of things could be going on, what kind of things could be the problem, and to take hints from your examiner, because chances are they've probably seen quite a lot of students who face the same difficulties with the station, and they do want to help you at the end of the day. Ask for help is a very good one. If you have an unfamiliar station that you've never seen before, if you have to deal with COVID, for example, in an ISCE scenario, asking for senior help would be your very first thing to do, because it's not for a fourth-year medical student to handle. But also, some people might try and think other things like 5, 6, 7, and 8, which are obviously a no-no. You can't cheat in an ISCE. There's no way you can cheat. You can't start to curse everyone, because it's not going to help. Don't start crying, because examiners won't give you any empathetic marks for crying. And obviously you can't stop others from scoring. You can't jeopardize the whole thing. But hey, by the end of it, you'll know that the time is up and you've done your exam. So we'll now be talking about a few tricks that we can share to you to help you make this situation easier to handle. So these are some tips that me and Ben and the rest of the other speakers have gathered with. I think Ben has a very good description of point number 5. You don't necessarily need to be good, but you just need to be safe. But it is recognizing the fact that all of us might not get the proper diagnosis or get a grasp of the problem straight away when you're faced with a difficult scenario. And this also exists in the real clinical world, especially in the time of COVID. All of us, junior doctors, we face problems at night shifts, people starting to spike their temperatures. We've got no idea what could be going on. And it is a little bit similar to having an ISCE station that you are not familiar with. What do you think, Ben? About this?
Agree. I think the important thing I would say, because I'm in the weird position now of being an SHO and during COVID having the F1s ask for advices, a lot of the time we don't know what's going on. It's again just about being safe. So this patient who's now got a new oxygen requirement, fine, we'll figure out what the cause of that is, but make sure they're getting the oxygen, make sure their oxygen levels are now safe. Then we can start talking about chest x-rays, ABGs, that sort of thing. So I would say some students try to overcomplicate things. Stick to the basics, stick to systematic approaches. Examiners absolutely adore systematic approaches. So talk about your A through E, talk about the presenting complaint, the past medical history, your exam findings, that sort of thing. A structured response sounds so much better, even if you don't actually say more stuff. Because it seems like just by having a structure, it seems like you know what you're on about. And being on post takes on medical take, you can tell when it's structured, it's just so much slicker, it's so much better. If you think about it, post take is kind of the ISCE when you've qualified, because you've been asked to see a patient, you've taken history, you've examined them, you've got their investigations, and then you're presenting to a senior. Doing that, when you present it in a structured way, you can tell when the consultant's like, okay, fine, it's structured, it makes sense. So I'd say, as we got up there, common things are still common. So think about your obvious causes. Better to be confident, get it wrong. Yes. That said, it's kind of like your medical interviews, from my point of view. Take a few seconds to get things clear in your head. Don't start just machine gun talking, which is when you just start blathering about lots of different things. A structured approach is really helpful. Okay?
Yeah, absolutely. I also think it especially applies for investigation stuff. I see on the previous mock that we did, that some people will literally just go, like you said, machine gunning on the results of a full blood count, for example. They know what you have to say, like, oh, this is a blood result for so and so, but they're kind of working along the way, like the full blood count is normal, white cell count is so and so, which doesn't really sound very confident, isn't it? Like, you might as well take half a minute, read it yourself, think about what is this, and then tell them straight away at the end. This is a full blood count that shows a microcytic anemia with a hemoglobin of 82, and obviously all of the other bits and bobs that would give you that extra sentence.
Yeah, I think you show some clinical aptitude then, instead of just reading verbatim, the white cells are these, the HB is this, the MCV is this, the platelets are these. If you take 5 seconds, look at it and go, fine, this is a neutrophilia with neutrophils of 15, normal HB. That's like, okay, fine, it's a neutrophilia. Instead of just rabbiting through everything.
Yeah, that's great. And like you said, you get points for mentioning what's obvious, and you don't necessarily need to be good in this difficult, unfamiliar situations, because you just need to be safe, and chances are everyone else will do very similarly. Okie doke. So now we're focusing on exam anxieties. Quite a lot of people will literally just ask quite a lot of questions in terms of this. So did I ask for allergies? Did I check for suicide risk if this is a psych station? And quite a lot of people can't get enough about this, was because simply, if you forget to do this, you kind of failed. And the thing that we kind of come up with is to make some cues for yourself, to remind yourself of, if you have done this or not. Like, I was just talking with Ben earlier about making some physical stimulus, didn't we? So I remember thinking about, you can pinch your nails in the background or do something that is physical to you, and you literally only stop that if you've asked them about their allergies or if you've asked them about their suicide risk. Other things is that in examination stations are scars. I remember literally missing a massive appendix scar on an abdo exam, simply because I didn't really expose the relevant areas. So remember to expose those areas. But even so, I didn't fail that station. So it is okay to miss things. You don't have to be perfect in an exam. They know we're humans. How about after the exam, your friends would tell you that, it's not pneumothorax, isn't it? It's PE. And you suddenly freak out because you've thought that you got it right. So it is right to, discuss some stuff, but avoid over discussions, because eventually it's a lose and lose scenario. Some of the things that you did well, your friends might not do well, and vice versa, and you end up making each other feel much worse. And how about if the examiner stopped you? What about to say, oh, that's enough, move on? It doesn't necessarily mean that they don't like your answers or they feel like you're rubbish. It could simply be in the interest of time on how things are, or simply they've heard adequate answers. They felt like you've said enough. You've said what's good, and this is quite common in ECGs. I remember doing an ECG, still trying to go through my A to E pattern and just talking about the rates and then the P wave and all of that. I've mentioned that it's an AF at the beginning, and as soon as I get to the QRS complex, he just said move on, which is not a bad thing. And how about things that you guys might be feeling now? There's so much to learn. I think I'm gonna fail. Well, there's a simple phrase that says, what's a battle when the soldiers have lost even before the war has started? It is quite a lot to learn, but they know, the medical school knows that you've all been in a very difficult situation, having to learn in the middle of a pandemic. They know you won't be able to learn with your friends, not going to be able to examine people on the ward, which is why they have adjusted the station. I have true feelings that all of them will try and help you to get a pass, but they just want you to be safe and to show that you possess the adequate skill to move on to year 5, to move on to be an F1 by now.
And if I could jump in on that.
Yeah, of course.
Just jumping in, no one wants to fail you. I've spoken to a lot of the teaching fellows whilst I've been on call and stuff. There are pragmatic reasons, there are nice reasons. Pragmatic reasons to fail someone incurs a lot more paperwork. There's that. Also, from a nice point of view, they want you to do well. If you think about it, you are going to be their future F1s, their future SHOs. They want to see you do well. And also, ISCEs are a chance for you to demonstrate, look at all I've learned, look at all this stuff. So, other things, the exam is stopping you. Yeah, as being said, don't worry too much about that. That's fairly normal, and it is. They're trying to usher you on so you can get more marks on the different bits. So, yeah.
Yeah. Things like washing your hands. I remember literally feeling like this, and it ruined the whole of my day because I literally can't remember. Did I actually wash my hands, or did I just fake that movement after 5 seconds? And the tips that we come out with is, again, physical stimulus. Like literally pinch your fingers, whatever, as you get in, as you say, hello, my name is so and so, I'm a 50-year medical student, and then reach for the gel, literally straight away. And how about the stations in between? I know you guys only have 1 day, so you don't bear the kind of like difficulties of, oh, I've probably failed 3 stations on my first day, and what's the whole point of continuing? But you can still feel it in your 4th, 5th, 6th, 7th station. But the whole point is, you may not have failed a station. You may have felt so badly about a station. That's literally how I felt about my unfamiliar station when I sit the ISCEs, and turns out no, it's fine. Like my score was along the average line, which is fine, and I felt literally shit on that station. I felt like, have I actually done that, done this, done that? And the feedbacks I got from the examiner, he didn't even pick up on those, because you don't have to be perfect in your examination, in your history taking, in order to score a pass.
And also, just jumping again on that, it's from the examiner's point of view, it's very difficult to find things that fail you unless it's one of the big scary ones. Also, there's no reason that, because the examiners only see you on the 1 station, you can sort of just carry on. They have no idea how you've done on the previous ones. So just as difficult as it is, once you've left that room, just try and forget about it. Just carry on. I'm sure it will all be fine. And also, I don't think anyone sat ISCEs and thought, yep, I've definitely nailed every station. I don't think anyone's ever done that. I actually passed all of my stations somehow, and I'm pretty sure that if I'd been examining me, I would have failed me on a few stations. So you're your own harshest critic. So yeah.
Yeah, absolutely. And this is to further show that points to you guys. This was the cohort performance of the last group of people who did their ISCEs, i.e. me and David and Sashi. So you can see here that basically the average marks is 63, the maximum marks is 74, and you can see that there's like one person who scored 74, and then 4 to 5 people who scored 73, and so on, you know. But basically, if you look at the standard set, ISCE was basically it's a very tightly regulated marks, really. So for those of you who kind of like think, oh, I need to score brilliantly on this exam because I can get my merits, my all that, then you got to work extra hard. But the good thing is, for the rest of us who want to pass, who want to, you know, just get on with medical school and then become an F1, it's a good thing, because all you have to do is to be average, and you're quite far off from the actual failing mark, like 63 and 50. I mean, fair enough, some people will say, oh, it's 11%. But looking at how many people are stacked up here, as long as you're an average of your 5 to 10 friends, you will pass. And you ask for your allergies, and you don't cause patient pain, and you don't, you know, all of the other things that will be covered tomorrow on the common mistakes people make in ISCEs. So to close off, we're just going to show a few tips and tricks in terms of what do you do if you panic or if you blank out. And this is not necessarily for between now and the ISCEs. This is more for in the day. What happened if you, oh, I literally don't know. I don't know the differential diagnosis of whatever, of jaundice, for example. Then you can apply these stuff that applies to almost every specialty. One is a breathing technique. We've actually got taught this by one of the consultant anaesthetists in UHW, who's very keen on, you know, helping out trainees with well-being. The things like breathing techniques, you take literally takes 12 seconds, 4 seconds to take a deep breath in, 4 seconds to hold it in, and then 4 seconds to exhale. If you do that 1 to 2 times, your heart rate will go down. You need to try it next time you feel quite stressed. And then take your time to acknowledge it. It's a difficult scenario. You can say to your examiners, I'm sorry, can you give me a minute, please? It is very valid to do that. You don't have to be a machine and answer them straight away. Oh, the differential diagnosis of jaundice is, I don't know. You know, you can take your time, recuperate your thoughts, and then deliver. And then other methods like investigations. Ben, you mentioned these boxes approach, didn't you?
Yeah. It's just a useful, so again, I know I keep banging on about structure, but it's always useful in part because it just buys you some time. Because you can say, so there are bloods that I would do, such as blah, blah, blah. There are other things I would do, such as requesting imaging, blah, 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 all those sorts of things. As well as that, in terms of differential, one trick I always used in my exams is I'd go, the differential is broad and includes vascular causes such as blah, and that's given you 2-3 seconds to let the rest of your brain just pick up. Also, you can structure other things. So talking about jaundice, you can go, there are prehepatic, hepatic, and post-hepatic causes. And sometimes examiners go, yeah, great, fine, because they know the structures of that, and they're like, yeah, clearly you've read a book at some point and you have a vague idea of what you're on about, tick, move on. Some examiners are like that. So again, I know I keep banging on about structure, but it's a helpful thing for you to fall back onto, and also examiners love structured answers. Mm-hmm. So yeah.
Yeah, absolutely. And there are lots and lots of other mnemonics out there which you can rely on in order to help you when you're really stuck. And at the end of the day, it's okay to say you don't know. If you've literally been asked a question that you've scratched your head, you've used all kinds of mnemonics possible, and you still don't know the answer, then you tell them, I don't know. It probably will not fail you, except if the examiner knows that you've said, haven't asked for allergies, and then you've prescribed penicillin, and then the examiner say, is there anything else that you would like to check with the patient before you prescribe this type of antibiotic? And if you said, I don't know, then there might be a chance that you might be safety marked for not asking for allergies. And hey, know that in a few minutes time this will all be over. You're going to move on with your life. You're still going to eat that day. You're hopefully still going to get some sleep that day, and fingers crossed that you'll pass. So we come to the end of our session. There is a feedback form that only have 2 questions in it. Literally says, is this useful, and would you like more of these? Because this is the very first time we've done this, and we would like your support if you think that this is useful. And now, if you guys have any more questions, if you have any questions at all, there are 4 of us in the panel who'd be happy to answer any.